Hi everyone, this is Linda Roysam from Massage Unwrapped, and welcome to our very first show. Before we get started with the interview with Tanya Chaney, she's going to be talking about myofascial trigger point therapy. I wanted to take a moment to thank our sponsor, Jeff Gold Music. His music is perfect for creative inspiration, healing, massage, yoga, or just winding down. You can listen to his music in the car, in your massage room, at home, or at the office. So check out his website at www.jeffgoldmusic.com. And now for the very first show of Massage Unwrapped. Hi, and welcome to the very first show of Massage Unwrapped. I'm your host, Linda Roysam, and joining me today is Tanya Chaney of Chaney's Natural Health, located in Pennsylvania. Tanya has been a massage therapist for 10 years, and one of her specialties is myofascial trigger point therapy. When she's not working, she spends time with her husband, Mike, and their 2-year-old Maxim. They enjoy gardening and just being together. She does enjoy her work. She enjoys her ability to help others, and she is very active in her local business community, and she finds time to serve on various massage boards. Tanya, welcome to our very first show.
Thank you, Linda, for having me.
So Tanya, what is myofascial trigger point therapy?
Myofascial trigger point therapy, Linda, is a form of body work that is very specific. It is the pioneered works of Janet Travell and David Simons. It is in its purest form a protocol which encompasses client history and intake, their complaint, detailed pain mapping. We look at perpetuating factors, different things about the pain, the quality of the pain, what makes it better, worse, and so on.
I've heard of trigger point therapy. Is myofascial trigger point therapy the same and it's just called a different name?
Yes, it can go by many different terms. In fact, myofascial trigger point therapy in the old term from the 80s is myotherapy. So you might hear it a lot of different ways, but it's pretty much the same thing.
Okay. And you mentioned that it was pioneered by Janet Travell and David Simons. Do you know how it came about or what started? How did they create it or why?
Yeah, trigger point therapy, well, the knowledge of trigger points has been around for a long time.
Mm-hmm.
Janet Travell is a cardiologist by trade, was a cardiologist by trade. And she was experiencing some chest pain.
Mm-hmm.
So being a cardiologist, she worked herself up and ran labs and such. There was nothing, she couldn't find anything wrong with it. And by coincidence, she was at a party one evening in a hallway that was rather crowded, and she backed into a coat rack, and the knob on the coat rack pushed her infraspinatus, which regenerated her chest pain. So from that started her research and her discovery of what trigger points are known today.
Exactly what is a trigger point?
A trigger point is a hyperirritable spot located within the top band of muscle. It's basically when the actin and myosin get stuck together and they maintain a contraction. NIH is doing tons and tons of research right now to learn more about the different components of what a trigger point is, technically speaking.
Is myofascial trigger point therapy an hour-long session, or how does that work?
Typically, yes, we try to do an hour. Sometimes the initial evaluation is a little longer because we are so detailed on the intake. And we do range of motion testing. We might do gait and posture analysis because we really are interested in getting at the root of the pain. So the first session can typically be a little longer, but on average, most clients book 60 to 90 minutes.
Do you combine that with another type of massage, or you do the trigger points the entire session?
It can be done either way. We have therapists that work both ways. Some trigger point therapists focus entirely on trigger points. I myself blend the technique a bit with massage.
What does a typical session look like?
Typically, when someone comes in, we will look at what their complaint sounds like or looks like for the day. We always kind of reevaluate, see where we need to go. If it's a trigger point session exclusively, they will remain closed. We lay on the table. They will lay on the table. We will apply flat palpation, pincer palpation, a lot of different techniques to do compression on the trigger points. And then we follow that up with a little bit of passive stretching.
And I think you have a video clip for us to show a little bit about the, the evaluation or an actual little session. Can you tell us a little bit about, you have two clips, right?
two clips. They come courtesy of Katie Adams with 360 Neuromuscular.
Okay.
The first clip is a upper trapezius video clip. It shows her evaluating and palpating and treating trigger point in the upper trapezius muscle, which is very commonly the cause of tension migraine, tension headaches.
Mm-hmm.
The second video clip will be the vascularis, and that shows the therapist doing a snapping palpation to show the top band within the leg, and then you'll see the treatment technique follow.
Okay, let's take a look at those clips right now.
Reach your hand down. Good. And you're going to do it again. So as I grasp your trap, you're going to reach down. Good. Doing okay? All right. And go ahead, reach down. And reach down. And one more time, reach down. Yeah, great job. And relax. Over, pull back. You can see that top band there. Find the spot. Cue the patient to contract. That's much better. About 10. It's already changing. You feel how that works so well? And relax. And fascial stretch. Recheck. And extend. Relax. It really works. It's just fantastic. And pause.
Tanya, those clips were great. I'm glad that you were able to show those to us. Why would somebody want to get myofascial trigger point therapy as opposed to like Swedish or deep tissue?
Okay, typically people seek out trigger point therapy because they're experiencing some sort of pain complaint. That could be tension headache, that could be low back pain, that could be like a pseudo-sciatica. Sciatic pain perhaps doesn't have a bony or nerve origin, something that's coming from the muscle.
Mm-hmm.
Same thing with carpal tunnel syndrome, someone that's been diagnosed but doesn't really have an issue about their carpal tunnel. We can work on the trigger points in their scaling muscles, which are in the neck, to help alleviate some of that pain. So there's a lot of different things that someone might come to us with.
Okay. I was reading on your website about myofascial pain syndrome. Can you tell me what that is?
Myofascial pain syndrome is when a single muscle or a group of muscles has developed a pain complaint, a pain situation that hasn't been remedied with other medicine. Myofascial pain syndrome is responsible for nearly 90% of working age disability claims as we know it. So myofascial pain syndrome is something that is typically single or multi-muscle syndrome. It's usually a regional problem, so a shoulder, a low back, it's usually in one area, but what it can do over time is affect the body through the nervous system to make the entire body hypersensitive.
As you're describing that, I'm thinking of fibromyalgia. Is that the same thing, or is it something different?
They are different conditions. Fibromyalgia is diagnosed by a physician as well, and typically they diagnose that using tender points, which are points that are in a specific location, as opposed to seeking and palpating spots.
Do you normally work with physicians when you're treating your clients?
Absolutely, I certainly can. If they come on the recommendation or the referral of a physician, I certainly maintain correspondence and open conversation with the physician to direct care for the client, if they are welcome to that. Sometimes a client might come in with fibromyalgia or myofascial pain that's been undiagnosed, and I might suggest that they go and see a physician that is savvy